I was living in Arizona and my husband was in construction and we had health insurance. The day after JP Morgan crashed, my husband came home and had been laid off. So our plan was to fix our RV up, move back to California. He would get some kind of a job and we would rebuild our life. But after 5 years of, still being sick, he ended up passing away. All of a sudden, I found myself widowed with no money and on Medi-Cal. We did the American dream. It didn't work. I felt like I had been kicked out of the middle class and nobody cared. So then I went in to see Dr. Keogh at the Chapa-De, and I said, I don't know, I can't quite pull myself out of this. It's been 3 years now.
Well, Jill is a very pleasant patient who had a history of depression, but she's had some things in her life that has seemed to accentuate the depression.
When it came to especially therapy, they didn't have the services available. They had, even at Chapa-De, they had 2 counselors for the whole clinic, and you could only get in and see somebody once a month.
Well, Grass Valley, we're kind of in a rural area, and so depending on the client, sometimes the resources for them personally make it very difficult for them to commute. I had a patient once that when it came down to it, I said, can you just, maybe even if you just go there once for an evaluation? And they literally said, well, doctor, if I go down and spend the money for gas, I may not be able to afford food for that week.
A lot of us don't have cars that make it that far, and I'm one of them. So yeah, being unable to go down to Sacramento for counseling would be a hardship. Then I got a call from the telehealth people, Brandy. She said, well, we have this new telehealth program where you can come into the clinic and meet people online. And I said, oh, like Skyping? And then my first thought was, oh, that's really impersonal. I told her, I said, okay, I can do this. I said, but after I'm done, you have to give me a hug. I started seeing Jill. I've been working with her for about 3 months now. We've got a really good relationship. I have come up out of the depression. Brandy's always there to give me my hug afterwards, which, it makes it personal. You don't feel like you're just going and sitting before a screen. Here, I'm 5 minutes from the clinic. I just drive over there every Wednesday. Like, I'm getting actual quality therapy, the same therapy I would be getting in Scottsdale.
Well, in Jill's case, telehealth has just really been an amazing result. I think the next time I saw her, she was like a totally different person.
People care. That's the main thing, is these people really care that I get better and actually are giving me the help that I need. No, I don't have money, but I can have the same kind of health care as everyone deserves.